Hello, my name is Christina Herrin, and I'm the Government Relations Manager of Health Policy at the Heartland Institute. And today we have a special guest, Dr. Mary Ruwart, with us to discuss FDA regulatory burdens and the impacts that these regulations can have on your lives. So Mary, thank you so much for talking with me today.
Oh, it's a pleasure. Thank you, Christina.
Yeah, I've been following your work for a long time and definitely appreciate your insights. So I kind of just want to start off by talking with you about COVID-19 and what impacts the FDA has had on things like treatments and testing for COVID-19.
Mm-hmm. Well, sadly, the FDA started out by saying that we could only use the CDC's test for COVID. And this was a problem because the CDC's test didn't work. And so for 6 weeks, we really didn't have a good test in the US unless some of the doctors had pre-ordered kits from overseas, for example. And even domestic manufacturers were not allowed to produce kits for about 6 weeks. And the FDA also limited our ability to get protective gear for our healthcare workers, masks, gowns, things of that nature, and of course hand sanitizer for those 6 weeks. No new domestic manufacturers were able to produce those things, and we couldn't get them from overseas. So we had healthcare workers reusing disposable protective gear, which is very bad. Finally, the FDA relented and said, okay, now we're going to go just the opposite direction. Anyone can produce a test, anyone can produce gear, except when the alcohol producers, the whiskey producers said, hey, we have plenty of alcohol, we can make lots of hand sanitizer. The FDA put another restriction on them and said that they had to put a chemical, basically a poison, in the hand sanitizer. Why? Because the FDA was afraid someone might drink hand sanitizer made out of drinking alcohol. You know, our normal alcohol that we use to, clean a thermometer, for example, that's isopropanol. You can't really drink that. But the ethanol that the whiskey distillers had was drinkable. I can't imagine anyone drinking hand sanitizer, but because of that, the FDA said, that the whiskey producers had to contaminate the hand sanitizers. And the problem was the whiskey manufacturers were afraid that they couldn't clean their equipment afterwards. So they weren't going to go out and buy new equipment. It looks to me like some just went ahead and produced anyhow, in spite of that restriction. Of course, now the hand sanitizer manufacturing is geared up. And of course, now we do have tests. We do have protective gear coming into the country from other places and domestic manufacturers making it. Unfortunately, going from one extreme to the other, the FDA really didn't check the tests out to any great degree. And now we're seeing that we may have a lot of false positives in these tests. You notice that the number of cases has been going up. And initially, people were thinking, well, these are asymptomatic people. But now what's coming out in the scientific literature is that the way that we do the test may be skewing the results. So what happens when you take a nasal swab is you actually have to amplify or, make more of the viral particles or the pieces of the viral particles in order to measure it. And evidently that process works okay if you only amplify 30 times, but if you go beyond that, then the incidence of false positives greatly increases. And for most of the tests, that's what's happening. They are amplifying beyond this 30 cycle procedure. And we're just now finding these things out because, if you think about it, we don't do this for the normal winter flu because we don't consider all that dangerous. But with COVID, we're really breaking new ground in these types of viruses, which has a good side and, of course, a bad side. And the bad side is we don't know enough to always be right about what we're doing.
Right. Well, I appreciate your input on that. And it just does seem like FDA has created so many regulations that have serious implications on our lives. And I kind of want to talk about the cost to develop either a new vaccine or even, develop treatments for COVID-19 and how FDA is involved in that. What is your opinion on healthcare costs rising and the FDA's involvement there?
Well, actually, in 1962, there were new regulations passed around the FDA. It basically gave them open-ended, I guess you could say, open-ended permission to keep adding more and more regulations, and that's what they've done. Before 1962, it took about 4 years to get a drug from the lab bench to the marketplace. Today, it takes anywhere from, I guess probably the average is about 12, as much as, 14 years to get a new drug to market. So a lot of people die waiting for life-saving drugs. In fact, when the AIDS patients started to come to us and say, help us, with this disease, they quickly realized that we couldn't get those drugs out of the door fast enough. So they started hiring black market chemists to make the same drugs that we were working on in the industry. And by the time the FDA finally gave us permission to test in people, every AIDS patient in the country who wanted our drugs had already had them through the community distribution and were resistant. So we had to wait for new cases to be diagnosed. And in some cases, the FDA didn't prosecute. In California, where the activists were very well connected to the media, they left them alone. But in Texas, as you can see, if you've watched the award-winning movie, The Dallas Buyers Club, they were prosecuted and persecuted, even though the things they were distributing actually seemed to help. The hero in that movie actually had lived at least 7 years beyond his predicted lifespan once he was diagnosed with AIDS. And I think he could attribute that to the many nutritional supplements and things that were brought in from overseas and the treatments that weren't as good as what we have now, but helped. So, that's very sad that people had to worry about not just having AIDS, but being thrown in jail for trying to save their lives.
Right. And, here at the Heartland Institute, we're more of a free market approach, obviously. And we have a project called Free to Choose Medicine that, looks to reform the drug approval process. And, I think now we can connect this AIDS story to what's going on with COVID. There's a lot of connections there to be made. Do you have a personal opinion or idea of reforming the drug approval process, what your idea for the future would look like, whether that's for all drugs or even, potentially a trial for, getting a COVID-19 treatment out there, or even the PPE issue we've seen where they've limited that?
Well, I think the Free to Choose Medicine plan is a good one. And the reason it's good is that it's, how can I say it? It's more politically acceptable than what I would do, which would be basically to get the FDA out of the picture. So what this does, the Free to Choose Medicine track produces a second way for manufacturers to go. Normally, a manufacturer has to go through 3 phases of human testing. In the Free to Choose Medicine track, they only have to go through phase 1, safety testing, and 1 phase 2 study. The beauty of that is they can then go into the Free to Choose Medicine track if they wish, never need really FDA approval. And so it creates 2 separate tracks. And because it has reporting requirements, we'll be able to compare the benefits or the detriments of each track. And I think it's an excellent way to go because I think it's something that politically could be passed. And of course, the right to try was evidence that, people want choices. And today with the internet, people know there are choices. Before the internet, they didn't know that. Now they know that. The problem with the right to try is that it allows patients to negotiate with the drug companies, but the drug companies know they still have to get FDA approval. Right. And that they can be punished by the FDA, which can drag its feet and make it very difficult for a company that is the first to invent a really good new life-saving drug. They can prevent that company from being first to market. And whoever is first to market gets about 90% of the business. So this is a big thing. And so I think companies, from my experience, 19 years in the pharmaceutical industry, I would say companies are going to be hesitant to do that. Luckily, there are a few that have said, hey, we're going to do it anyway, and I applaud them. They've got real courage.
Yeah, I completely agree with you, and I think that market incentive wasn't changed much with right to try, and the actual drug approval process, still stands today very similar as it did before right to try, even though the intent was great. But the policy has helped, like you said, a handful of patients, and that's phenomenal. But I think also there is a revolution of people, especially I think with COVID, it exposed a lot of the flaws within FDA, and we're really seeing that now, where people want the freedom to choose medicine or treatments, and they don't want Big Brother in the exam room kind of making those decisions. So yeah, I completely agree with you. And I want to talk about one of your more recent books, Death by Regulation. What are some key takeaways from that book? And in your mind, again, is it possible to reform the drug approval process? I mean, you did kind of mention that with free to choose medicine, but in terms of your book, can you mention some of the key takeaways with the regulatory burdens?
Yes, well, according to published data, which I simply put together and did the calculations for, it looks like our current FDA process, as compared to prior to 1962, has taken 5 to 10 years off each of our lives. This is in the US, but what happens in the US ripples outward. So, these numbers get much bigger when you recognize that most of the new drugs have come historically from the US. So if the US's innovation is compromised, which these regulations do, then those drugs aren't there to save anyone's lives in the third world or Europe or anywhere else. So, we've all been affected by this. And one of the biggest problems, I've just given you kind of five years as the calculation, just from having to wait an extra decade or so for the drugs, the loss of innovation. But the other 5 years is my guesstimate as to how much we've lost because of the shift from prevention to treatment that these amendments, these changes in the law in 1962 have caused. When I was doing research with animals, we didn't have all these genetic manipulations. So our rats were so healthy. They had all their vitamins and nutrition, and they didn't get sick. They basically died of old age. So what we did to create things that looked like human disease is we took their vitamins away. We reduced them greatly. And what I learned from that, and many of the other researchers did too, is optimal nutrition is key to staying healthy. But because of the way the FDA operates today, it's rare that people really can understand that, because the FDA actually prohibits commercial speech if it hasn't approved it. In other words, let me give you a good example. So the B vitamin, folic acid, can prevent what we call neural tube defects. It's a type of birth defect that is so severe, most of the children either die or are institutionalized. And we can test for these in utero. So that means that a lot of these babies are aborted. But folic acid can basically prevent it if the woman is taking the folic acid when she's getting pregnant, the first month or two. And most women don't know that they're pregnant during that time, so you have to take it prophylactically, in advance to prevent the problem. And when this was known in the early 1980s, the FDA told the folic acid manufacturers that if they talked about these scientific publications that showed this, that they would be shut down. And then when the Center for Disease Control, another government agency, started talking about this in the early 1990s, the FDA once again told the folic acid manufacturers if they advertised the CDC's recommendations or even mentioned it, that they would be prosecuted. And so in the US, most women didn't know that they could prevent these horrific birth defects by taking folic acid. In Europe, though, in some other countries, the government even paid for the advertising to tell people, women, of childbearing potential, to take folic acid. And of course, their rate of these neural tube defects went down. What the FDA did is it started demanding that cereal manufacturers or grain producers put folic acid in the grains. But of course, a woman never knew how much she was getting. It depended on how much of this stuff she ate, right? Yeah. So we really didn't get much protection from that at all. And I call this really the American thalidomide, because the 62 amendments were put into place to prevent what happened in Europe with thalidomide. It was a safer sleeping drug, but women started taking it for morning sickness, and they'd have babies that were born without limbs. And in the US, the media was so hyped up about this that Congress passed these 1962 amendments, which have created horrific side effects, not just with the babies and folic acid and the American thalidomide, but shaving 5 to 10 years off each of our lives. And these amendments are open-ended. These regulations grow every year. They metastasize. Now, if we were having safer drugs, we might be willing to wait a little longer. We might be willing to pay a little more, because 80% of what we pay at the pharmacy are due to these 1962 regulations. But if you look at how safe drugs were prior to 1962 and how safe they are now, you really don't see much difference, because before 1962, about 2.5% of all the drugs that reached the market were withdrawn for safety reasons. Now, since the 62 amendments, it's about 3.3%. That might not be a big difference, but it's going in the wrong direction. The amendments promised that we would have fewer withdrawals, and that has not happened. In fact, the most deadly drug of all times in the US, Vioxx, was put in place and marketed after all of these regulations were in place and after all this testing. So really, it has not protected us at all. And
Yeah.
we just don't know the science. There's going to be some mistakes made. Our science isn't good enough, unfortunately.
Right. That's really interesting too. The goal should be obviously to create the most, safe and effective drugs as possible, but also at the lowest cost. I think often we're so concerned with safety that we are so concerned with efficacy, that we forget that the free market's, the best way to decide what's effective or not. And I also wonder, can you touch on this a little bit about regulatory capture issue and, why this is, a horrible situation that these smaller startup biopharmaceuticals are in, and you have, oftentimes this big pharma companies that are able to kind of streamline their processes while others are kind of left to the wayside within this big FDA bureaucracy.
Yes. Well, of course, as the timeline increased to 14 years, from 4 to 14 years, people started getting concerned about how long it was taking for a drug to get to market, rightly so. But the solution that they saw was not a very good one. And the solution that they eventually passed was that manufacturers could pay the FDA $100,000 per drug to get a faster review. And the FDA would get a faster review by using this $100,000 to hire more regulators to review and process things quickly. Now, recall that the FDA review process only took 2 of those 14 years. And these regulations did shave about a year off the development time. The problem was this $100,000 has now morphed into about $2.5 million,
Wow.
which means that about 50 to 80%, depending on the year, of the FDA's salaries of people who review these drug submissions, their salary is basically mostly paid by these fees, which means that, for example, when Vioxx was approved, even though some people in the FDA said, the data suggests we might be getting more heart attacks, the person who really was pushing for a delay in Vioxx approval was told by his supervisor that their client, the FDA's client, were the pharmaceutical firms, because of course that's who's paying their salary. And so now the FDA has been somewhat co-opted, possibly greatly co-opted, depending on how you look at it, by the very people they're supposed to regulate. And this is not uncommon. If regulations gets very, very strict, the only way companies can survive under that burden is to co-opt the regulators. And so this is not surprising that this happened. This is what, economics 101 would predict.
Right. Well, I really appreciate your insight and taking time to talk with me today. Do you have any final thoughts for our listeners?
Well, I guess I would just say to your listeners, if you want to know more details about the FDA, you can check out my book, Death by Regulation: How We Were Robbed of a Golden Age of Health and How We Can Reclaim It. And of course, you can go to my website, ruwart.com. There you'll find in the lower right-hand corner of the homepage links to all my social media. If you'd like to know more, you can ask me questions through my website, and I'd be happy to answer them.
Great. Well, thank you so much. And we will make sure to attach some of those links below too. So if any of y'all are listening and interested, please feel free to follow up with us.
Yes. And thank you for the interview, Christina. And best of luck with Free to Choose Medicine. We need it.
Yeah, thank you so much.
Thanks for watching this video. Please subscribe to our channel and consider donating to the Heartland Institute to support more vibrant free markets, greater individual liberties, and more videos like this one.